General surgery, I have read your notes only, sir. I didn't make anything else.
They have to read Bailey except GAT and orthopedics and gynecology cover to cover, and then Savistan, GAT and hepatobiliary part. If they have time, they can read specialties from Savistan also, and Schwartz, breast, thyroid, and vascular diseases, parathyroid.
MD Anderson, sir. MD Anderson, I made notes completely. I have read the cover to cover. And then all treatments from Devita, every cancer, I have added and included in my notes. And then some cancers like skin cancers, melanoma, SCC, BCC from NCCN guidelines, sir.
Book should be the base, then add on from definitely from uh, videos. Sir. Videos definitely you have to add on. If you want to get a top rank, videos must.
Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty. And I'm joined today by Dr. John as well, who's the Surgical Oncology faculty in the Marrow SS program. And we have the great honor of interviewing Dr. Pavan Kumar, who secured rank 24 in the recently conducted NEET SS exam. So heartiest congratulations, Dr. Pavan. You've secured a great rank in the surgical oncology part, and we are very certain you're going to land up in Tata, Mumbai, which is the premier institute. So heartiest congratulations from the entire Marrow team.
Thank you, sir. Thank you so much.
So why don't you tell us briefly about yourself? Where did you do your MBBS, your MS from, and for how long have you been preparing for the SS exam?
I did MBBS from Padamula Medical College, Mangalore. Then after that, I did MS from Government Kilpak Medical College, Chennai, through NEET. After that, I given my sincere attempts, last 2 attempts. Now I cleared.
Okay.
This is my second sincere attempt and I cleared.
So you've been preparing since last year, since 2020?
Yes, sir. 2020 January.
Right.
Yes, sir.
And you've been a Marrow Pro user. So let's divide the discussion into 2 parts. I'll ask you about the general surgery part, and Dr. John will ask you questions regarding the surgical oncology part. So you started in 2020 and you were using Marrow. How did you cover the general surgery portion for your exam?
Sir, I have read Bailey, sir, full cover to cover, except orthopedics and gynecology part. Then GAT and hepatobiliary from Savistan, I have read. And after that, I watched your videos completely. And then I solved MCQs also, Marrow general surgery MCQs. And then I read your notes, sir, multiple times.
Right.
I think in last preparation, 5 times I read.
Wow, 5 times is great. I think
5 times,
so.
yes, sir.
Revision is the key, and that's what you're trying to highlight, that the more number of times you read the notes, you get that visual memory, which is what we talk about. So Dr. Pavan, one constant question which I get from postgraduates or students who are preparing for the SS exam, they say that it takes a lot of time to watch the videos. I personally think that the videos can be completed in 15 to 20 days. How much time did it take you to watch the videos?
Around 10 days, sir. Around 10 days.
Great. Great. So you watched the entire general surgery videos in 10 days. I'm assuming that you used 2x speed to watch all the videos.
Yes, sir. 2x speed.
Okay. And did you use the pre-made notes to study, or you made notes while watching the videos?
General surgery, I have read your notes only, sir. I didn't make anything else. I've read your notes and I have highlighted, underlined, and added new points. That's all, sir. Completely your notes.
Great. Now, Dr. Pavan, before I hand over to Dr. John, if somebody is preparing for the next NEET exam, which is going to be purely general surgery based, what would be your tips to those candidates? How should they approach general surgery?
Sir, they should read Savistan, GAT and hepatobiliary, sir, completely. That part. And the specialty part also they can read from Savistan completely. And from Bailey, except orthopedics and gynecology and GAT, they should read sir, cover to cover, except everything. If they have time, they can go and read Savistan general part also, even Schwartz, breast, thyroid, and vascular diseases. I think
So
that would be enough.
you're recommending them to read this and add the extra points to the videos and
Yes,
the
sir.
notes of general
And
surgery.
that. Yes, sir.
And how useful were the MCQs in Marrow? You said that you did the general surgery MCQs as well. Did you
Yes,
find
sir.
that the level of difficulty was similar to that asked in the NEET exam?
Yes, sir, sir. It is similar, sir. Your MCQs is good, sir. It is properly prepared. I think you have spent so much time to prepare. And some are repeat MCQs, some are repeat topics. I think it is sufficient.
Right.
There always there is new questions comes, but 80%, 90% we have to cover, sir. That's all.
So over to you, Dr. John. I think so. You can elaborate on the surgical oncology part, and I'm sure a lot of our users want to listen to how Dr. Pavan prepared the surgical oncology part.
Congratulations, Pavan, first of all, for securing a very good rank in NEET SS. I know you went through a lot because there was a lot of confusion about the dates, the pattern, and finally you came out on top. So, congratulations.
Thank you
So,
so
the
much, sir.
first
Thank you.
question I would like to ask you is you took oncosurgery. What was your second specialty of choice, and what were the two reasons why you took this specialty?
Sir, surgical gastro, sir, second specialty. Because it is near. I have read Sabiston, GAT, and hepatobiliary. I have read Bailey also. So I thought I could answer more. And I'm not interested in other subjects. That is one more thing, sir.
Okay.
Subspecialty of
So,
surgical onco is SG. Yeah. I mean, cancers.
subspecialty of surgical oncology is ST. Okay.
Yeah, yeah.
So,
Cancers part, I mean.
cancer part, yeah. So,
Cancer.
you took oncosurgery because you were exposed to oncosurgery during your Kilpock days.
No, sir. Actually, I thought of doing broad surgery, sir. Suppose if I concentrate on only one part, I thought I may feel bored at certain point in my life. Doing only some similar set of surgeries, like three, four surgeries, four, five type of surgeries. In long term, I may get bored. So I thought surgical onco would be right choice to me, sir, because I can do wide variety. It will not bore me. It will excite me
Okay.
in
So,
long term,
coming to
in long
the
run.
coming to the preparation part of it, I
Yeah.
understood that you were working and preparing at the same time. So I just want
Yes, sir.
to tell you to tell the viewers that is it possible to work and study at the same time, and how good was Marrow in your preparation? Because for you to work and watch Marrow would have been made it easier, I think, because
Yes, sir. Definitely,
you
sir.
have something ready made, right?
Yes, sir. If you are working, if you have videos, it would be easier, sir. It is like one revision. Already you have a notes, marrow notes. You can just underline and add new points. It will be very easier, sir. You can complete so much. If you start reading by yourself, it will be little difficult. But textbook reading one time or two times would be sufficient if you can add
So
on
you
new
read your
points.
textbooks. So what did you do first? You read your textbook and then watched the video, or you just watched
Yes,
the
sir.
video? So you read the textbook
First, I
once
read
and then
textbook.
watched.
Yeah,
First
then
you read the
watch it, sir.
text and
Then I
then
came
watched the
to
video.
know, yes, sir. Then I came to know that Bailey, so much Bailey is in SAR notes, Rohan SAR notes. So much
Yes.
Bailey. Then only I realized. Otherwise, I could not realize if I don't read textbooks.
So another question is, which is a
Mm.
common stumper that happened here because ENT, ortho, and gynec was included in this year's NEET SS, and it was there in general surgery part as well as the surgical oncology
Onco
part.
part.
And how did you go about preparing for it?
Sir, I have read like NEET PG, sir. NEET PG notes I have read. These three, and I have revised two times. Same
So
thing.
the
That's all.
ENT,
I didn't do any
ortho,
other.
gynec part you revised from NEET PG Marrow.
Yes, sir. NEET PG notes. Yes, sir. NEET PG notes. And I
And
have
so
revised.
that is the base. Your NEET PG
Yes, sir.
notes was your
Definitely.
base. And you
Yes, NEET PG
extrapolated
notes I have.
all your oncology from that.
Yes, sir. Correct.
Were there any specific reference textbooks which you read cover to cover for oncology specifically?
Yes, sir. MD Anderson, sir. MD Anderson, I made notes completely. I have read the cover to cover. And then all treatments from Devita, every cancer, I have added and included in my notes. And then some cancers like skin cancers, melanoma, SCC, BCC from NCCN guidelines, sir. Even sarcoma also, because treatment varies from each book.
If dermatofibrosarcoma protuberance, 3 centimeters margin given in Devita, but if there is no clear-cut margin given in NCCN guidelines, 2 to 4 centimeters. Even in this one also, sir, MD Anderson also. Like that, so you have to read multiple books to get it. One book will not be sufficient.
So the questions in NEET SS, both general surgery and surgical oncology, were they more like factual questions or where there was a element of reasoning and concepts in it? What did you feel as a gross feeling? What was it?
Sir, reasoning, sir. It's a reasoning. Always they will ask this one, sir. Which stage for the treatment?
So you have
Which
to
stage?
use
What
your
will be
theory
treatment?
knowledge and extrapolate it to a question. You cannot get a direct factual question.
Yes, sir. There are some questions, generic questions are there. That is difficult to answer, sir. Even though we read, it is difficult to answer. It is quite new, but we can try.
So now I just, as last question, I would like to ask you, what is your message to the upcoming NEET SS aspirants? What should they base strategy for the upcoming NEET SS? How should they prepare? How many months? How much of revision? And what are the textbooks? In short, in a nutshell.
Yes, sir. If they are working, they should prepare for at least minimum 6 months, sir. If they are not working, 3 months, 3 to 4 months will be enough. They have to read Bailey except GAT and orthopedics and gynecology cover to cover, and then Sabiston, GAT and hepatobiliary part. If they have time, they can read specialties from Sabiston also, and Schwartz, breast, thyroid, and vascular diseases, parathyroid.
Great.
That will be sufficient.
So, Dr. Pavan, do you feel that Marrow it offers all the subspecialties to the candidates, unlike other places where you just have to choose one subspecialty and you just get that content? So, with the change in the current pattern of exam, don't you think it is better to have access to all the subspecialties and then you can choose the important topics and prepare them for the NEET SS exam?
Yes, sir. Book should be the base. Then add on from definitely from uh, videos, sir. Videos definitely you have to add on. If you want to get a top rank, videos must. But base should be the books.
And what I mean, how many hours of videos versus MCQs were you doing on a daily basis when you were preparing?
Sir, MCQs I didn't concentrate much, sir, because I know the pattern how they ask. So I didn't concentrate like I have to do these many MCQs like that. Whenever I finish any topic reading, I will solve that MCQs, sir. If I make that mistake in that MCQ, I will write in my notes so that I cannot go and redo the MCQs.
Right, right. And how many times did you revise? Because I guess, when you're reading such technical information about treatment and the management, just reading once is not sufficient. So, what will be the minimum number of revisions which you would recommend for any student who's preparing for such exams?
3 times, sir. Minimum 3 times, 3 revisions minimum, sir. 5 revisions maximum. That is enough, sir.
Right. So, as Dr. John was asking, any parting comments for residents who are now starting their preparation for future SS exams? Any words of motivation for them?
Just to add to that, should we start your preparation right from your first year of surgery residency? That is one thing. Should you start seeing your marrow videos or general surgery videos? Did you watch marrow videos from your first year of surgery residency?
No, no, sir. I have purely concentrated on general surgery only. I did not do any videos during my MSPG life, sir. But if you do in the final year, it is definitely beneficial. I think videos came only that time, sir. That part of the time, so I could not use that. If now I am doing DBG, definitely I will start from second year itself, sir. I'll not waste my time.
Great. So it was a pleasure talking to you, Dr. Pavan. Thank you very much, Dr. John and Dr. Pavan, for joining in. And we wish you all the best for your future, Dr. Pavan.
Thank you, sir. Thank you so much.